And good day, everyone, and welcome to the Multi-Region Summit on Engaging Villages as Key Partners for Healthy Aging Research. My name is Emily Greenfield, and I am a professor and director of the Rutgers School of Social Work Hub for Aging Collaboration. I'm geographically located today in northern New Jersey, and I identify as a white woman with long dark hair, glasses, and a blurred background on my Zoom screen. On behalf of our summit planning team, I just want to express how truly excited we are all to come together for today's program. Next slide. So today's program will take place in 5 parts. In this first part, I'll help orient everybody to the larger project that today's summit is a part of. We'll also introduce you to the members of our project team, as well as the fabulous Villages Healthy Aging Research Ambassadors Group. The next 2 segments will cover key content. The first on villages and healthy aging, and the second on village research partnerships. In these segments, a research partner will present and narrate slides, followed by commentary from members of the ambassadors group. We'll then place all participants randomly in a breakout room. Ambassadors and project team members will facilitate a guided discussion on the content presented. We'll be recording these breakout rooms and carefully listening to your voices on what you believe as promises and priorities for future healthy aging research as part of the Village movement. And then in our final 15 minutes together, we'll reconvene as a large group. Dr. Bill Kincaid, Village to Village Network Board President, a member of the Ambassadors Group, and Barbara Sullivan, Executive Director of Village to Village Network, will offer concluding remarks. We'll also ask you to respond to a few more questions at that time. Okay, next slide. So today's summit is part of a larger multi-organizational project titled Engaging Villages as Key Partners for Healthy Aging Research. This project has been in development across 3 organizations, Village to Village Network, the Rutgers School of Social Work Hub for Aging Collaboration, and RAND. Our 3 organizations began meeting 3 years ago to explore opportunities to advance policy-relevant research on how villages promote older adults' health and well-being. Next slide. In 2023, we were fortunate to receive funding from the Patient-Centered Outcomes Research Institute, otherwise known as PCORI, through a Eugene Washington Engagement Award. PCORI is an independent, nonprofit, non-governmental organization that came about in 2010 as authorized through the Patient Protection and Affordable Care Act. It's a research organization that funds comparative clinical effectiveness research, which we'll describe later in today's program, to develop actionable information about people's health and healthcare options. Please note that the statements presented in this presentation are solely the responsibility of the authors and do not necessarily represent the views of PCORI, its Board of Governors, or its Methodology Committee. Next slide. So the purpose of our project is to rigorously spur national dialogue among village members and leaders toward the design of future research projects on optimizing villages for healthy aging. Toward this aim, our project has 4 components. Next slide. First, we've developed a website, villagesresearch.org. This website serves as central intelligence for our collective efforts through this project. Second, our colleagues at RAND conducted a series of focus groups last fall with village participants throughout the United States regarding their perspectives on how villages promote healthy aging and priorities for future research. You'll hear a lot more about the report based on the focus group findings as part of today's summit. Third, we organized the Villages Healthy Aging Research Ambassadors Group. This group has about a dozen village leaders from throughout the U.S. who've been meeting twice a month since February to collaboratively design and facilitate today's virtual summit and to identify critical issues to consider in the planning of future healthy aging research with villages. And then finally, we have our virtual summits, which are taking place throughout June and July of 2024. All insights shared during the course of the summits will feed into an additional project report, which we hope will be further helpful to villages, researchers, and other stakeholders to identify priorities for future collaborative research on villages and healthy aging. Next slide. So on the topic of the Ambassadors Group, it is with great pleasure that I introduce our members as listed on this slide. Special shout out to ambassadors who will speak as part of today's program, Pat Murray from Cleveland Westside Village in Ohio, and Angie Levenstein from the Village Chicago in Illinois. Next slide. And a further shout out to you all, today's summit participants. Our team is so excited to see the range of village settings, perspectives, and experiences that we collectively bring to today's event. We're thrilled to welcome people from across the United States and even a few participants who registered from Australia. In the US, over half of those who registered for today's summit are located in either the Midwest or the Mid-Atlantic New England regions, with Illinois and Ohio accounting for nearly 30% of everyone who registered. Across geographies, 82% of people who registered for today's event come from communities that are either urban or suburban, and 15% are located in rural communities. In terms of the group's connections to the village movement, the majority of today's attendees have a primary affiliation as a village board member, volunteer, or staff member, with 67% of registrants identifying as such. We also welcome village researchers, service providers, government officials, leaders of regional networks of villages, and others, including people who are interested in learning more about villages or who are currently developing a village, as well as people in community development and in healthcare. So next slide. So before we begin our content of today's program, I want to take a few minutes to launch our first poll. We have 3 questions to ask of participants, and we'll ask 3 similar questions at the end. We'll use these data as part of our project's evaluation and also to further chart a clearer vision for future collaborative work on villages and healthy aging research. We ask that project team members and ambassadors refrain from participating in the poll at this time, but we welcome everybody else. Please note that unless otherwise indicated, only members of the Rutgers research team will be able to link the information you provide in response to each poll question with the information that you provided in your Zoom registration, including your name. When we report on findings during the course of today's virtual event and in subsequent project reports, no identifying information about yourself will be shared. Participating in any of today's polls or surveys is optional. So I'll now ask Natalie to display the first question, and I'm going to read each of the questions aloud. So here's our first question. Prior to today, which of the following best describes your knowledge of patient or person-centered outcomes research? This is a type of research that focuses on the health outcomes that matter most to the people being studied based on their preferences, values, and needs. So the first response option is, I've never heard of it before. Second, I've heard of it before, but I'm not entirely sure what it means. Third, I have some basic understanding. Fourth, I understand it well enough to explain to others. We appreciate your honest responses, nothing right or wrong. Again, this question is, which of the following best describes your knowledge of patient or person-centered outcomes research? Thank you to so many of you who have submitted your response here. We'll wait a few more seconds to give others a chance to chime in. Excellent. We still see some responses coming in. Okay, I think we can end. Oh, got one more. Give you another 5 seconds. Okay, great. So we have 22% never heard of it, 29% heard of it before, but not entirely sure what it means. 33% have some basic understanding. 16% reported understand it well enough to explain to others. Thank you so much. We'll move on to the second of 3 questions here. So prior to, we need a pre-question B. There we are. Excellent. Okay, prior to today, which of the following best describes your knowledge of comparative effectiveness research? This is a type of research that compares different programs or approaches to test which one improves health outcomes the most. Again, first response, never heard of it. Second, I have heard of it before, but I'm not entirely sure what it means. Third, I have some basic understanding. And fourth, I understand it well enough to explain to others. So again, this question is with respect to which best describes your knowledge of comparative effectiveness research. Thank you again so much for everyone who submitted their responses. We still see responses coming in. It's excellent. We'll give another 10 seconds for those who still want to press submit. Thank you. Great. Okay, I think we can go ahead and share the results. So 31% never heard of it, 27% heard of it before, but not entirely sure what it means, 31% some basic understanding, and 10% understand it well enough to explain to others. Excellent. Okay, our final poll question here. We'll move on to the pre-question C. Great. Prior to today's summit, to what extent did you read the report, Insights on Developing Research Capacity for Healthy Aging with Villages? The first response option is not at all. Second is a little. Third, most of it. Fourth, all or nearly all of it. So this is, to what extent did you read the report, Insights on Developing Research Capacity for Healthy Aging with Villages, prior to today's summit? Thank you so much to those who are participating. We really appreciate it. See the responses are coming in. Still see a few more responses. We'll give it another 10 seconds for final responses on to what extent you read that report. Excellent. Okay, I think we can stop there. So we have 48% not at all, 27% a little, 15% most of it, and 10% all or nearly all of it. Great. Thank you so much to everybody for participating. And without further ado, I will now pass the mic to our colleague at RAND, Regina Shi, who will present on villages and healthy aging.
Hi, everyone. It's so nice to see you all here today. I'm Regina Shi, and I'm with RAND, which is a nonprofit research and policy organization. So I'm going to start off today by reminding everyone about the goals of our project. So Claire, if you wouldn't mind hitting next. So first, our goal was to understand how village participants think about healthy aging. And if you click again, the second goal is to learn about how villages support healthy aging. And the third is to identify what helps or hinders villages from participating in future research. So what did we do to meet these three goals? First, we held 5 focus groups with 49 participants across 18 states in late 2023. These 5 groups include 2 that consisted of village members, another focus group of members with a healthcare background, and a focus group with paid professionals and officers, such as directors or board members, and then lastly, a group of leaders of regional networks of villages. This report was published in April of 2024, and we're now sharing the findings from that report with village members at summits like this one for your reactions and your engagement. So next, I'm going to provide a brief overview of a few key concepts that are at the heart of this effort, and we'll start with patient-centered. So what does patient-centered mean? This project, as Emily noted, is funded by the Patient-Centered Outcomes Research Institute, and when one receives funding from PCORI, projects must focus on patient-centered outcomes research. So what does that mean? Patient-centered outcomes research means that the research focuses on individuals' preferences, values, and needs. In other words, we're studying the issues that matter most to you. Patient-centered outcomes research also involves individuals in planning, carrying out, and sharing the results of research. I'd also like to mention on this slide some nomenclature. So patient versus person-centered research. Of course, we know that not all villagers are patients, and patient is a term that's usually a medical term. It's a residual from the early days of PCORI when they funded research mostly out of hospitals. But now PCORI recognizes that it's important to study people living in the community. And so its research portfolio has expanded to include community residents. And so now it makes sense to use the term person-centered research, which is what we do in the report. So I'll go next to this term, comparative effectiveness research. So this is research that compares different treatments, programs, or methods to see which one works best. So I'll give you an example. You have program A and you have program B, and both have already been shown to reduce hospitalizations in a randomized controlled trial under ideal conditions. Comparative effectiveness research takes that and it compares the effectiveness of these 2 evidence-based programs and applies them in real-world conditions using outcomes that are important to people and patients. So patient-centered outcomes research is one type of comparative effectiveness research that centers individuals' preferences, values, and needs. And so we are following these principles, and therefore this project aims to involve villages early in the research process. And we really want to understand what matters most to you and your villages, and what types of programs you are most interested in for promoting healthy aging. Finally, I want to clarify the distinction between intervention programs and services. So we can think of an intervention program as a planned set of activities designed to bring about changes or improvements in health or behaviors. So an example could be an educational activity, or it could be policy changes, environmental improvements like giving more access to green spaces and public gardens, or health promotion campaigns. On the other hand, an intervention service is a support or help to address specific issues or challenges. So it can be a skilled treatment indicated by a client need, maybe group counseling, family counseling, educational groups, skills training, occupational therapy, medication-assisted treatment, or psychotherapy. So we can turn our attention now to the main findings of the report. And so the first question we asked during the focus groups was, what does healthy aging mean to you? And in response, we heard a broad range of definitions of healthy aging, and these included good physical health, good mental health, cognitive health, and a sense of social well-being or a sense of purpose. Importantly, healthy aging was also seen as a facilitator to aging in place, which is illustrated by this next quote, and this came from a healthcare focused member. I think too often older adults are thought of as one group. We don't think of children as one group. There are stages of childhood and there are stages of elderhood, and I think each stage has different priorities, different sense of purpose, different abilities, and different needs. And I would say for me, the baseline is to be able to remain as healthy and engaged as possible in place, whatever place I choose. So there's also in the focus groups a strong interest in changing how we think, how society thinks about aging. And so instead of a negative decline, focused on being better prepared for the changes that come with getting older. So this quote is on this next slide from a village professional or an officer. We do live in a culture where aging is seen as a negative, that somehow you're deteriorating as you age, and not an empowering perspective on being able to live life to the fullest, especially when you have all of the experience and some resources and some time. We also heard that focus group participants felt their perception is that healthy aging is highly dependent on the healthcare infrastructure around them. Healthy aging depends on a healthy infrastructure around us. And that infrastructure from a healthcare perspective requires, I think, that there be robust partnerships between physical healthcare organizations and community-based organizations. Illness lives in the hospital, but well-being lives in the community. So there need to be robust partnerships. We also wanted to know how villages support healthy aging. And again, we heard numerous ways in which this is happening. First, villages act as a catalyst for social connection. This comment from a regional leader is representative of this mechanism. We try pretty religiously to plan something every week for our members so that they have the opportunity to come together, have conversation, share ideas, and it gives them that opportunity to go back to all the things we just sort of shared, like purpose. It gives them a purpose. Another way in which villages support healthy aging is by facilitating maintenance of function and independence through prevention. One of the things we did, of the physical care needs was we hired a case manager, a care manager, a nurse practitioner to kind of formally go in and assess what we saw and members' declining health, because they will all decline at some point, and then be able to do some formal intervention with the family and with helping them set up what they need for their next stage in life.
Oh, Regina, you gotta unmute.
Oh, sorry. Villages were also seen to act as hubs for information and referrals to community services. Just call us if you need anything. Even if it's not something we offer, we can connect you to somebody else, another nonprofit that does that, or another group in the community that does that. And I think that's a really important piece. Just the service as a connector to other resources is an important benefit of villages that goes almost untracked and unspoken of, but can provide a huge lifeline to people who may be struggling or feel like they're alone in this aging process. We learned earlier that some participants felt that healthy aging was seen as dependent on the healthcare infrastructure around them, and related to that, we heard villages can be bridges to the healthcare system. For instance, a regional leader said, another concept that someone in my group is just beginning to float, and it's very premature, and we're trying to flesh it out, is how could you possibly add a more structured, recognized, formal next level that links villages to the care system? It's not there yet, so it's a long way to go. But this concern about frail members is a big one for an increasing number of villages. Another important aspect of Village's role is service as a source of home and yard maintenance services. We had our snow shovel help. I'm in the Northeast, and last winter, I got a call from one of the volunteers who said, "You need any help shoveling?" She came over and we were both out there. It was a help. Village gives us contacts for who's a good handyman, who's a good plumber, what's a good electrician, because I can't do those things anymore, or at least not as much as I used to. Finally, villages were seen as advocates for sustainable funding to support healthy aging. We advocated to get villages into the multi-sectoral plan for aging for our state. If we're going to narrow down to who we're going after for funding for our villages, it's healthcare and the state government. I hope this was a useful summary of our focus group activities, and this concludes my segment of today's presentations. And I just wanted to note that the findings were reported with regards to villages as partners in research will be covered by Dr. Greenfield from Rutgers in a later section. And so I just wanted to take a moment to say thank you to the focus group participants for their time, expertise, and insights. Thanks.
Well, thank you so much, Regina, for being here today and on so many other days to share your voice and insights as part of this project. We're really grateful. So I want to share that, like Pat, I also have a dual identity as both a researcher and a member of what I like to call the village public. In addition to my role in higher education, I also am a core member of a group of people that has been working to develop a village in my own town in New Jersey. It's because of both these hats, that is both as the director of a Hub for Aging Collaboration and as a partner working to develop a village in my community, that it's really a pleasure to present on villages and research partnerships as part of today's summit. So next slide. So villages have long time recognized the importance of cultivating partnerships across groups and organizations to better the lives of individuals and communities. Nearly 10 years ago, a national survey of villages found that the vast majority of villages reported partnerships as very or extremely important to achieve their goals. Nearly half had formal collaborations with another entity through a contract or memorandum of understanding, with the most common partner types being social service agencies, healthcare organizations, home health, faith-based organizations, and government. More recently, we find that sponsored villages, where a village operates under the auspices of another organization, as well as hub and spoke villages, are among the fastest growing types of villages. Next slide. So research organizations, of course, can be partners too. This project actually embodies this idea with two research organizations, that is Rutgers University and RAND, operating in partnership with each other, with the Village to Village Network, with village leaders through the Ambassadors Group, and in coordination with other organizations like WAVE and Village Movement California. So we're curious to know if your village has partnered on research or data collection. Feel free to let us know by typing a message in the chat, and we also love to hear more about your experiences in the breakout room segment. Next slide. So what might motivate villages to partner on research? This question was explored in the fall focus groups. Findings indicated that villages are eager for there to be evidence of the impact of villages across multiple levels, including their benefits for individuals, for communities, economic systems, and health systems. Focus group participants expressed their belief that such evidence will lead to enhanced village sustainability and reach. This quote on the next slide from a focus group participant expresses this idea well. We'll go to the next slide. If you could document the effect of belonging to a village, you could find it easier to raise money to support the village. That specifically has a benefit in that if we could get money from philanthropies or government sources, then we could lower our dues and make it easier for people to join. We're curious to know what else might motivate a village to partner on research. So heads up again, we'll hope to talk more about this in our discussion rooms. Next slide. So focus group participants had the opportunity to brainstorm recommendations on future research topics. This slide presents the 4 thematic categories that emerged as ideas for future research questions. The first theme relates to questions concerning how to more effectively engage current members of villages. The second theme addresses strategies to diversify village membership. The third category includes questions about the trajectory of villages as organizations, as well as the arc of the village movement more broadly. Finally, the fourth category presents questions regarding how villages and their programmatic offerings can lead to healthy aging outcomes and other benefits. For examples of specific questions under each category, please refer to Table 2 in the report from the focus groups. For our time together today, I want to highlight how comparative effectiveness research could fit in with these recommendations. Again, comparative effectiveness research is a type of research that compares different programs or approaches to test which one improves health outcomes the most. So let's consider a hypothetical example in the context of two of these categories for future research directions: how to promote member engagement and how villages benefit their members' health and well-being. Villages at their core are a network of people. We know that many people who are part of villages are highly engaged. They volunteer, they attend community programs, and they ask for help when they need it. But for some people, their participation might drop off over time. Our research question could be, what approach works best for re-engaging members in village activities and benefits? And does this re-engagement lead to improved healthy aging outcomes? Well, building on the idea that villages are all about peer-to-peer connections and volunteers, we could design an initiative where we train volunteer outreach callers to contact members who haven't been participating for a while. We can help them learn two different techniques. Program A would use one set of techniques or strategies to re-engage members. Program B would use a different or distinct set of techniques. In terms of comparative effectiveness research, both programs would have some scientific evidence behind them, indicating that they should be helpful for motivating behavior change. Our goal here is to test which one works best. Next slide. So this slide presents a brief overview of how such a research study could take place. First, we would ask village leadership to identify specific members in their village who are relatively dormant by some criteria, such as they haven't requested a service or attended an activity within the past 6 months. Then they would be invited to participate in a study. After the individuals consent to participate, we would ask them to complete a questionnaire about themselves, including questions about their psychological and social well-being, let's say. The researchers would then randomize people to receive phone calls from outreach volunteers that use either approach A or approach B. They would receive these phone calls over a period of time. And in the meantime, we would track their engagement and activity with the village. And then we would ask them to complete another questionnaire 6 months later to see if they report higher levels of psychological and social well-being than prior. Next slide. Okay, so that was quite a bit of information, but before handing the mic over to Angie for her commentary, I want to just go over one more key section from the focus group report, and that is, what will it take for villages to engage in partnerships on research projects like the one just described? So here are a few key points. We'll go back to the slide. Yep. First, focus group participants noted that a strength of villages is their dedicated staff and volunteers who are eager to pitch in and passionate about advancing villages. At the same time, village leaders tend to be stretched with many demands on their time. Therefore, the development of new projects and partnerships must plan for and ensure sufficient human capital among villages for projects to be feasible and successful. Second, focus group participants emphasize the need to consider villages' varying data infrastructure. For example, building from the hypothetical study, some villages might have very detailed records that allow us to easily identify members whose participation has dropped off, but other villages might not have such data readily available. Planning for future projects needs to account for this variability. And finally, focus group participants express the need for clear and transparent communication from the research partners, especially up front. What will the project require from village leaders and the village members who are asked to participate? Who will have access to the data that are used or generated by the research project? And how will the results from the studies be shared back to villages? These are some of the conversations and decision points that need to be planned out early in project partnerships. Well, now I'm going to transition on to the discussion segment of today's summit. In just a minute or two, you will be redirected to a breakout room. All breakout rooms will cover the same set of questions and topic areas as summarized on this slide. Please note that there's an assigned facilitator and co-facilitator for each breakout room, and we'll be recording the breakout rooms and later analyzing transcripts as part of the larger project. You are welcome to continue using closed captioning and the chat during the breakout session. We also encourage and invite you to turn on your videos and unmute yourselves, of course, for the breakout room discussions. Heads up that the breakout rooms will close at 15 minutes past the hour, and we hope the groups will get to as many questions as they can. You'll receive a 1-minute warning before everybody is, heads up, abruptly moved back into our large Zoom room for final remarks, poll questions, and announcements. So thanks in advance to everybody for their thoughtful participation, and we look forward to reconvening here at 15 minutes past the hour. So I'll go ahead and ask Natalie to go ahead and open the breakout rooms and move people to them. Enjoy. Welcome back, everyone. I hope the breakout rooms went well. I know ours was really engaging and informative, so thank you everyone for your participation in that segment. I'm now going to go ahead and pass the Zoom mic over to Dr. Bill Kincaid, who is Board President of Village to Village Network, for some closing remarks. Bill, we need to unmute.
So a special thanks to our partners at Rutgers and RAND for helping us through this process, and to the ambassadors who have really been very instrumental in getting us through the starting of this engaging process. And I also want to thank each of you for attending today and helping to introduce this topic and beginning this important dialogue on healthy aging, comparative effectiveness research, and person-centered approaches to research. These will be ongoing topics of discussion in the Village movement for years to come. So this dialogue is really an invitation to help construct a better future for all aging Americans, not just ourselves, but those who will follow us. Villages can add to the knowledge base of healthy aging through research, and villages and villagers should play a role in helping to design and carry out this research. It will mean learning new terms, meeting new challenges, and forming new partnerships. But villages and villagers have been learning new terms, meeting new challenges, and partnering for over 20 years. It's who we are. The village movement is still small, and it's growing, but we need to grow. And outcome research is an important building block for our future and will help put wind in our sails. There's a growing body of information on the factors that affect healthy aging: exercise, mental health, cognitive function, social interactions, in-home support. But there is actually very little scientific information on the health outcomes of belonging to a village, where in many cases, several or all of the above factors come to bear at once. We are a great laboratory to carry out these studies. Next slide. So why is outcome research important for Village? It will help us prove our value. It will help us become better known. I think we're one of the best kept secrets in the aging space. So we really need to let people know what we do and how we do what we do. And we need to learn more about those factors as well. It will help us with advocacy at the local, state, regional, and national levels, with both government and private institutions. Demonstrating the value of the village movement may well attract new funding sources and help support the incredibly valuable work that villages do in building our communities, paving a path for future elders, and also preventing social isolation. So it will also help us expand the village movement. It will make current villages bigger and create more villages. And finally, it will also attract future leadership and a more diverse membership. So next slide. So are we ready for this? It will take a lot of preparation on our part. The answers to these critical issues about how we get engaged in research and how we move forward are going to take some work on our part to prepare ourselves for this process. But I think we would be good partners for healthy aging. We are grassroots, trusted, member-driven organizations and are already involved in healthy aging, some villages for over 20 years. We have great networking with strong national and regional organizations. The Washington Area Village Exchange and also Village Movement California have been very helpful in moving the processes forward in their areas. But other networks are forming as well at the state level. DC Villages and the District of Columbia functions like a state, although we are not a state yet. But other states are involved as well: Virginia, Massachusetts, Pennsylvania, Florida, Illinois, Ohio. So it's important, I think, to put these groups together and develop the synergy that we need to move forward. So we're already working on the aggregation of data, looking at the outputs that villages have. How many rides do they provide? What kind of events, what kind of programs do they put on? But we do need to spend more work looking at the information systems that we all use. And is this information system a good foundation for future research? Or do we need to mutate that system into something more efficient and more effective? So we also have a robust model for reaching to underserved populations. This was especially true during the pandemic, when I think villages really began to reach out to those in their communities who needed help and needed access to the services villages offer. Reaching out to traditionally underserved populations is critical. Expanding access for everyone to the supports that villages offer will benefit us all. So next slide. So we also have very strong leadership, both the executive director, the village boards, and individual members that staff the various committees that make things happen at the village level are very, very important in building community in their areas. In a sense, villages act as the eyes and ears and the change agents for their communities. So the other reason I think we're good partners is that villagers use their experience to take a broad view of aging. It's not just the biology of aging, the psychology of aging, the social issues, the spiritual issues, but they take a whole person approach to aging. And I think this offers a very important viewpoint as we look at developing research projects and the services that villages offer going forward. Villages are also inventive. We do what we can with what we have where we are. I've been really struck by the flexibility that many of the villages have offered, come up with it to meet challenges in their own community. And I think our mantra is first network, then partner, then grow. Bring resources to your neighborhood by working with other groups to make sure that the people in your village have the services and the access that they need. And finally, the village movement is fundamentally aligned with the strategic framework for a national plan on aging. The Interagency Coordinating Council, chaired by the Administration for Community Living, has come up with a report, next slide, that came out in May. And we're trying to develop a process for villagers to weigh in on this national dialogue that has come out from the Administration for Community Living, and you'll be hearing more about that in time to come. But advocating, I think, is important, and this is one very important opportunity for villages to weigh in on a very important document. So with that, I'll turn it back over to Emily, because I think we have a couple of closing surveys.
Thank you so much, Bill. We really appreciate all of your leadership on the VDVN board and with the movement and as part of this project. And indeed, before we close out, we want to just do one more quick round of polling questions. Heads up that the first two questions are going to be familiar and the final one is important, so stick around. So Natalie, if you can go ahead and launch the first of the three questions, great. Here it is again. Which of the following best describes your knowledge of patient or person-centered outcomes research? This is a type of research that focuses on the health outcomes that matter most to the people being studied based on their preferences, values, and needs. Again, first response option is never heard of it. Second, I've heard of it before, but I'm not entirely sure what it means. Third, I have some basic understanding. Fourth, I understand it well enough to explain to others. So thank you so much to everyone who's submitting. This is, again, level of knowledge of patient or person-centered outcomes research. If others want to go ahead, we'll take another 10 seconds in case others want to submit their response. It's great. Okay, we can go ahead and end the poll and share results. So we have 6% never heard of it, 3% heard of it before but not entirely sure what it means, 64% some basic understanding, and 27% understand it well enough to explain to others. Great, let's move on to the next one, number 2 of 3. Great. Which of the following best describes your knowledge of comparative effectiveness research? This is a type of research that compares different programs or approaches to test which one improves health outcomes the most. Again, first response, never heard of it. Second, heard of it before, but I'm not entirely sure what it means. Third, I have some basic understanding. And fourth, I understand it well enough to explain to others. So again, this is best describes your knowledge of comparative effectiveness research. So again, thanks to those who've already participated. Give another 10 seconds or so in case others are still waiting, thinking about it. Great. Okay, I think we can end the poll and share the results. So 6% never heard of it, 3% heard of it before, but not entirely sure what it means. About 60% some basic understanding, and about a third understand it well enough to explain to others. Excellent. Okay, last question. Here we go. So this question reads, are you interested in being contacted about potential opportunities for villages to partner on research projects? Please note that your response to this question only, linked with your name, organizational affiliation, and email address from your summit registration information, will be made available to all members of the project team and specific others as relevant who are also interested in cultivating future research partnerships with villages. So simple first response is yes, and second response option is no. So again, thank you to those who are clicking and submitting. It's great. Give another 10 seconds for people to think about it. Okay, thank you so much. Okay, I think we can end it there and share results. So we have 94% marked yes and 6% marked no. So thank you one more time again. And one last heads up from me. When you exit the Zoom meeting, your internet browser will pop open and you'll find a brief online questionnaire that invites your feedback on today's program. We'd be so grateful if you could take just another few minutes to share your perspectives that way as well. We'll also send a link to it in email if you have to rush off to your next thing and can't get to it. So with that, I'll turn the mic over to Barbara Sullivan, Executive Director of Village to Village Network, to close out today's summit. So next slide, great.
Emily, thank you so much. And thank you, Natalie, Regina, the Rand, Rutgers, our ambassadors. Bill, a lot of work. I mean, this is, we have one more next week. And I think it's been so super successful. And I look forward to, as Bill mentioned, and we mentioned in our little breakout session, the National Plan on Aging. We will be giving some direction from V2V and some of the thought leaders throughout the country. We've met once, we're meeting again next week. The very exciting part of all this is that V2V has been invited to do a listening session, the board of directors. So we are with the Administration on Community Living. I'm going to do a little plug for our virtual conference. We have a great virtual conference coming up on September 25th and 26th. The early bird is open until August 1st. It goes up a little bit, but you get some savings and there are some group rates. So this is great. I also will plug that Village Movement California is having theirs September 12th and 13th in person, and WAVE, Washington Area Village Exchange, is going to have an in-person gathering also in October. I believe it's the 15th. So look for more details on that. We're very excited. And we hope you have a great week. And thank you all so much. Again, thank you so much, Rutgers, Emily. And next week is Wednesday, the 31st at Southeast Plus. So if anybody in your organization didn't get to attend and they want to, you can go on villagesresearch.org and you can sign up for the Southeast Plus summit for next Wednesday. So we're looking forward to seeing everybody. And thank you so much for, have a great week.
Thank you, everyone. For those who would like to stick around in the Zoom room, like informal chat, we're happy to keep it open for a little bit while some large group commentary, questions, thoughts, but understand people need to jump off too. So just want to say thank you again, and we hope to see you soon.